Sleep tools. Oh, this is me sleeping on the office couch over here. I wonder where that picture came from. Well, is that interesting is that over the last number of years, I've been working on my sleep quality and sleep duration. So the teams put together a really neat presentation about how to sleep better, some of the tools, and we'll highlight some really interesting facts about sleeping. Um, if you watch this video 5 times, you'll fall asleep. Just kidding. Let's hear more. Take it away, guys and ladies.
Alrighty, so this is just a quick plan. We're going to talk about lots of things, tips, but mainly about the tools. So some supplements, some medications, some trackers, pros and cons of them. But we're going to start off a little bit with some of the harms, essentially what the need is. We talk a lot about hypertension management, cholesterol. We don't talk about how much people sleep. I was wondering actually if that's a question that some physicians should ask as a risk factor. We know shift workers have higher risk, but we don't ask much about sleep, so we're going to talk about that a little bit, what the harms are long term. We know about the effects of short term sleep deprivation. It makes you feel terrible for some people. Some people can tolerate it okay, but the short term effects are quite clear. But the long term effects, this is a summary of what happens to your body. If we can take a look, some of the stress hormones are elevated. We're not going to get into the specifics of these hormones called leptin and ghrelin, but essentially the net effect is that it makes your appetite a little bit higher, and also you crave certain kinds of foods, known as junk food. So it tends to, for some people, make you overeat, and that's why they call it a little bit of obesogenic. If you're chronically sleep deprived or you're just getting less sleep on a consistent basis. Some of the other effects, some inflammatory markers. We're not going to get into the names, and but you can see some of them: IL-1, IL-6, CRP. These are associated with long-term disease, heart disease, cancer, etc. And so these are the combination of things that happens, and the long-term consequence is just an increased risk of cardiovascular disease, obesity, type 2 diabetes, cancer. It goes on and on. I call it a little bit of a silent killer. It's a little bit like hypertension because it's not talked about as much. Everybody knows it's important, but we don't talk about its actual impact as a risk factor. So we're going to do that tonight and bring it to everybody's attention. This is a very quick study showing the connection between how long you sleep and your diabetes risk. Now, diabetes, another word for it is insulin resistance, a little bit different, but the process before diabetes is insulin resistance, and you're essentially pre-diabetes. After a period of time, your pancreas cells do not produce as much insulin, and you develop type 2 diabetes. That the risk of type 2 diabetes goes up the less you sleep. So you can see on this chart, comparing people who sleep 3, 4 hours, 5 hours, 6 hours, the less and less you go, the risk goes higher. So this is very good information to share with people that when you think about your risk factors, sleep is something to think about also. It's not just hypertension control, cholesterol, weight. Those are absolutely fundamental things, but sleep is also another one. It impacts your appetite. It has something to do with your weight management journey. If you're having trouble with junk food, fixing your sleep is a component of it. Same thing here. This is another study showing what is the optimal sleep duration to minimize diabetes risk. We can see in this graph, 7 to 8 hours is the lowest risk. This is an observational study. It's a meta-analysis of prospective studies. It's observational. It's not randomized. It has limitations, but by and large, for most people, 7 or 8 is a little bit like the 10,000 steps per day measurement. It's not super precise, but it seems like for most people there's a good target to look at. But we're going to talk about more about how much you need. But that's generally what the evidence says: 7 to 8 hours for diabetes. Now we're going to talk about a little bit with sleep cycle. What even is that? Why it's important? I'll pass it on to Siwan. Take it away.
So for a regular sleep cycle, this is what a regular sleep cycle would typically look like. To start off, we would have our awake session, and then it goes down by stages. So a night typically have several sleep cycles that we go through. Stage one is where you feel a little drowsy, such as when you're in a lecture and you start to kind of feel your eyes dropping down, but then you're mentally still kind of awake and your body's still active. So that is stage one, where you're just feeling drowsy. Stage two is where your muscle starts to relax and your mind starts to settle down. So that is kind of when you start to fall asleep. And stage three and four are the deep stages of sleep, where the muscles have been completely relaxed, and the mind is also settled, so you're not thinking of anything. The person is well rested and they're falling asleep. After you go down to stage four, the cycle actually goes up and it reaches a point called REM, which stands for rapid eye movement. So this is the stage where your body is still paralyzed, but your mind is very active. So this is when you're dreaming in the middle of the night. And a typical good night of sleep will have around four of these sleep cycles, with each one of them getting a bit lighter over time until you naturally wake up. So this is what a regular sleep cycle would look like, which with each cycle being about 90 minutes, totaling up to 8 hours of sleep, roughly, for a normal for individuals. Next slide, please. So one common myth that we have when we talk about sleep is we should probably have a lot of REM sleep, because that is what's been focused on social media for quite a bit. However, after doing a bit of research, we realized that we probably shouldn't go right into maximizing the amount of REM sleep. And the reason is because that sleep cycle is a cycle that happens overnight. So when you actually increase the amount of REM sleep a person has, you're actually taken away from non-REM sleep. And when you look at the purpose of REM sleep and non-REM sleep, they serve fundamentally different purposes. So you can't complement one with the other. You have to look at both together in one situation. So the purpose of REM sleep is for memory consolidation, emotional regulation, and brain development, all of which we are aware of because of social media. But the purposes of non-REM sleep, such as stage 3 and stage 4 sleep, is for physical restoration, where your muscles have been paralyzed during the middle of the night. It's for energy conservation, also very importantly, memory and learning. So short answer to, is REM sleep the best and should we maximize it? Both yes and no, because REM sleep is absolutely essential. You can't just get rid of it. But also non-REM sleep is important as well, in the sense that we need physical relaxation and also mental relaxation. So we have to find the right balance instead of just leveraging on one type of sleep. Next slide, please.
So, question for you, and you can still either of the. So, I like this idea. I heard about a lot about REM sleep, but one of the important things is, how you learn and memorize, and that's important for memory consolidation. I like that concept of that. Deep sleep. What phase is deep sleep? Is that stage 3 and 4 or just stage 4?
It's stage 3 and 4 together. They're very difficult to separate. It's just, I think one of them is more like more subtle, more as where the brain ECG has been stabilized.
And
So
and, some,
no. Yep,
and some episodes feel that in deep sleep, that's where a lot of the cleansing of the brain takes place, and is that.
exactly.
And so the two most important parts of sleep, some people feel, is the REM sleep and the deeper sleep that you get, and you cycle through that. And is that still your takeaway message?
I think so, yes.
Perfect. Tell us more.
All right. I think the next question to ask is what happens to this sleep cycle as you age? So, this is an example on the left side. We're comparing a young adult to the older adult. You can see that as you age, one, total sleep duration goes down. But besides from that, the actual sleep cycles, you start to get less and less of the deeper, more restorative sleep, and also less of the REM sleep. Now, um, it seems like the third step, or the stage 3 is important, but also REM is important. But we're going to talk about sleep trackers, but part of the tool that they provide is that you can see how much of your sleep is light sleep, how often are you waking up, essentially how much are you spending time in the deep sleep. And if you're not spending time much on it, your sleep quality is affected. Now there are questionnaires for sleep quality. It's a very good question. How do you even measure sleep quality? We're going to talk about that in the next few slides. But essentially, this is what happens as you age. It becomes more challenging to have more quality sleep, and so we have to work harder at it. Just like all the other things that has to go into getting healthier. Unfortunately, when you get older, things get difficult. This is no different, unfortunately, but there's some optimism. The other question is, how much do you actually need? So we had an interview a few years back with Dr. Waymond from McMaster. He's a medical director of a sleep clinic, and we asked him in our previous webinar. You can check it out. This is the previous webinar, it's called Sleeping Better. About this question, how much do you really need? And here's his response. I'm just going to share with everybody. Give me one sec here.
Raymond, I was at a different talk recently, and I was struck that a newborn sleeps about 16 to 20 hours, where people age 65 on average is about 6 hours, and our sleep patterns do change. People get fixated on these numbers, and some people sleep 3, 4 hours, some people sleep 8 hours, and how do you tell people if they're getting enough sleep? They seem to want to get a number of hours a day. Is that really important?
Yeah, that's a brilliant question. And so the issue for most people, we know that the distribution of height follows a bell curve, the Gaussian distribution. And the distribution of sleep requirement is the same thing. There's a bell curve where some people need as much as 10 hours sleep, some people can get away with 6. And so when you try and force everyone the crime of procrustes to make them all fit into your mythical 8.5 hours, it doesn't work. Some people are more efficient in their sleep than others. And so as the purpose of sleep is really mainly for the brain, it's a function of the brain, by the brain, for the brain, largely, and we increase our cerebrospinal fluid, so-called lymphatic flow during sleep, acting like a car wash to wash out the tau and amyloid protein that develops during the day. And so that process, in some people, is done very efficiently, in other people it's not. And so really you can only gauge whether you're getting enough sleep is how you're functioning the following day. So if you're not sleepy the following day or feel you need a nap, you are getting adequate sleep as long as you're not over-caffeinating or using some other type of stimulant to keep you awake.
There we go. We hope that was helpful. So essentially the TLDR, the key takeaway is, one way to go about it is if you're feeling rested the day after, that's a very good indicator that you've had a restorative sleep. If not, probably not. Maybe the precision, some people probably care more about the precision in terms of how much they're spending in deep sleep, light sleep, REM sleep. But for the average person, for us, that's what matters. If you're feeling well rested, it's probably a good indicator of good quality sleep.
So,
go ahead,
so
Dr. Curnew.
Ryan is a expert, and it's a long video. But I would encourage anybody who wants to explore sleep to look at that video, stop, start different parts of it, and look at some of the. So to me, that's a key information. I learned that since then I've been trying to improve my quality and quantity of sleep. And you're right, Rad, is that um, I have to work at sleeping better, and we'll show some times where I do a good job and at times where I do a bad job. But I think that's something really, really important. But I really like the concept is um, how energized. I remember my aunt says she slept 3 or 4 hours and she was always full of energy. I've seen some people sleep, 8 to 10 hours and they don't look like they had enough sleep. So really important. So let's learn a little bit more about this. So very much individual choice.
Yeah, it
And
seems to be that the subjective component is actually is relevant. It is important. Um, I think he also mentioned that if that is without caffeine, without adrenaline, because there are people who can completely feel alert, function normally with stimulants, or with a lot of adrenaline. People have jobs where they require them. Let's somebody working in the emergency department, the adrenaline is also high. The cortisol is also a little bit elevated above baseline, so that helps them to not feel the effect of sleep deprivation as much. But on another day at home, they probably feel it more. So that's also a good distinction to make. This slide it just tells you, aside from the subjective feeling, what are the other parameters of sleep quality. We have 4 here. One is sleep latency, how long it takes you to fall asleep. This is personally something I've had a lot of trouble with. I still do. Some days it's better, some days it's not. Some people, as soon as the head hits the pillow, they go to sleep, but then they wake up many times in the middle of the night, and then it takes them more than 20 minutes to go back to sleep, which is one of the indicators of low sleep quality if it consistently happens. So essentially, it's not terrible if you wake up a few times in the middle of the night, as long as you immediately go back to sleep. But if you stay awake consistently, night after night, that can be an indication that you probably have to try a few things and see what the issue is. Is it stress? Is it the food you ate? Is it something else? The second, sleep efficiency. Yeah, we can measure these by some of these trackers, but some people find it useful, some people it's too much. We talked about sleep waking and also wakefulness. How much are you awake after you wake up in the middle of the night? So there's a subjective component. There's some of these questions you can ask yourself. The other question is 5 hours enough? So it might be a little redundant. We just want to show this, that even if you feel fine, are you still doing damage long term to your body? This cohort study of 25-year follow-up showed a decent answer to this question. Again, it's not a complete answer because it has some limitations, but they looked at a cohort of around 8,000 people, 32% of which were women, and they compared the people who slept 7 hours or thereabouts to people who slept just under 5 hours long term. And they found that people who slept less, they had a 30% higher likelihood of developing multiple morbidities. So essentially, different chronic diseases, diabetes, heart disease, obesity, etc. Interestingly enough, no association was found between sleep duration and mortality among people with existing chronic diseases. Again, we don't want to read too much on that, but the takeaway from this is that yes, you might feel fine with 5 hours of sleep, but in long term, you're probably still not optimizing your health in terms of insulin resistance and things of that nature. Again, we understand people have tough lives, but in terms of getting healthier, at 7 to 8 hours, most research papers are suggesting is probably the sweet spot to hit. Again, want to be practical. It's not always possible for most people, but something to work on.
All right, so now we know what normal sleep looks like. Let's talk about a few common sleep disorders that we discovered that's normally that is present in the population. So the first one is insomnia, which stands for difficulty staying asleep and falling asleep. So people typically view insomnia as having trouble falling asleep, laying on bed for several hours and not being able to go to sleep. However, the other part of insomnia is difficulty staying asleep. So certain times people wake up in the middle of the night due to various reasons. And if this condition lasted for more than 3 times per week for over 3 months, then that could be categorized as insomnia. And at that point, you should really go to your healthcare practitioner to check out what's going on. The second really big factor contributing to sleep disorder is sleep apnea. So this is when breathing stops and restarts many times during the middle of the night. Common symptoms of people having sleep apnea is waking up with a very dry mouth or having a feeling of gasping for breath in the middle of the night. There's 3 different types of sleep apnea. First one being obstructive, so that is something that's mechanical. That could be having your tongue closing up, on having your tongue closing up if you're breathing with your mouth on your airway, or that could be something that's nerve related, so a nervous route for sleep apnea, which is related to the central nervous system. And there could also be a complex one, which usually occurs when people are treating for obstructive sleep insomnia for sleep apnea, and that unfortunately leads to neurological changes as well. The typical treatment for sleep apnea at this point is using CPAP machines during the middle of the night. So you see people wearing a mask with a machine that can continuously deliver oxygen to the patient. And unfortunately, that is the most common treatment for sleep apnea. The third type of sleep disorder is narcolepsy, which is a neurological disorder that affects sleep-wake cycles. And this can be quite dangerous at times because patients with narcolepsy couldn't control when they're falling asleep. So they might be active in the middle of the day, and then all of a sudden their brain tells them to sleep, and they might just fall asleep in the middle of their activity. So imagine a patient in the middle of the road driving, and suddenly their narcolepsy kicked in. The last sleep disorder is restless leg syndromes, and this is a strong urge to move legs because of uncomfortness or psychological distress. Treatments may include seeing psychiatrists, as well as kind of just expendituring their energy during the daytime so that they're not as restless per se during when they're about to sleep. Next slide, please.
By the way, anybody who has restless leg syndrome, one thing you have to make sure you're not iron deficient. So that's just something that make sure of. That you can measure a ferritin level. Tell us more.
So yes, of course. So something else that typically occurs as people start to age is sleep fragmentation. Not this doesn't only occur as people begin to age. This could also occur under a huge psychological stress. But a typical syndrome, a typical thing that physicians have observed for sleep fragmentation is the lack of S3, S4, and REM sleep. And if you remember, we talked about these stages previously during our REM beneficial discussion. So essentially, S3, S4, and REM sleep are categorized as are the essential components that are helping you to recover in the middle of the night. In other words, they might as well be the major purpose of you having a long night of sleep. So if you're lacking if you're having sleep fragmentation or lacking these components, your sleep is not doing the purpose that you want them to do. And a common cause for sleep fragmentation, next slide, please, could be um, these factors that are highlighted on the slide. So these may include, but are not limited to, hormonal changes, which includes melatonin, lifestyle habits, which includes consuming too much caffeine or alcohol, or smoking before sleep, or being on medications such as antidepressants, or if you have some sort of disease, such as diabetes and prostate issues, which causes you to urinate during the middle of the night. Or it could include sleep apnea as well as angina, which essentially prevents the patients from staying asleep due to various reasons, such as chest pain or need for breaths. And lastly, heart failure is also a common reason that could cause sleep fragmentation. So the way to prevent these from happening could include lifestyle changes, which means which can include but are not limited to limiting the amount of alcohol you drink, preventing preventing the use of screens and devices before sleep, which includes TVs, phones, computers, etc., which causes a contribution of blue light, which inhibits melatonin, and also inhibition of caffeine. So no caffeine before 2 or 3 hours before bed, as that also interferes with the normal hormones that are produced. A few things that you could do to improve your sleep quality and to kind of reverse these changes would be being physically active, or following a diet routine, which Harm is going to talk about, or consulting your healthcare practitioners on things that you might do that might help you with following a better sleep routine. Click, please. One more. So one thing that's really commonly observed in elderly is nighttime urination, also known as nocturia. Common causes for nocturia could include enlarged prostate for males, as when prostates get enlarged, they do kind of apply this extra pressure that causes a person to urinate a lot more, having a sensation of they haven't fully urinated. A common cause for females would be bladder prolapse or possibly uterine prolapse that causes this additional pressure on the bladder to force the bladder to continuously to empty itself. And some things that you could do to avoid nocturia is speak to your doctors to rule out any underlying conditions. If you know the direct cause, hopefully you can figure out a treatment that reduces the symptoms or treat it overall. You could also reduce evening fluid intake, as if you know your bladder is empty, you won't have to get up for nighttime urination. Also avoid diuretics such as caffeine or alcohol. And lastly, make a diary of when you're drinking to see if you're drinking beyond your thirst. Next slide, please. So now that we've talked about sleep itself, let's talk about a few sleep tracking technology that we could use to track how we're sleeping. Next slide, please. So a few common sleep tracking technologies that are available on market include rings, watches, and non-wearable devices. Rings are a physical piece of ring that you would put on your finger. These have been reported to be a little more accurate in terms of capturing your sleep phases. They're capable, most of them on market are capable of detecting heart rate, respiration rate, temperature, and acceleration to capture any movement. These are typically very small because it is a ring itself, so they're probably the less noticeable version of wearable devices. The second one will be watches. Watches do provide a greater variety of data to display. They're also capable of, one thing that is pretty good about them is that they're capable of setting alarms based on sleep cycle. So if you remember a sleep cycle graph from previous, it is better for you to wake up in the later stages. So during the stage 1 and stage 2 cycle of the sleep, rather than having you wake up at the deeper stages of sleep, because those are stages where a person should not be awakened. The last sleep tracking technology that we would like to talk about is non-wearables, and these include mattress covers and chest pads. And as I was doing my research, one particular population that I think could really well be suited for this technology would be women experiencing menopause, because one common thing that wakes women up during the middle of the night when they are in their menopause period is heat strokes, and these mattress covers as well as chest pads usually have the ability to adjust the temperature of the bed by providing a cooling system or a heating system. So that way it reduces the amount of temperature that is body temperature increase. So those are 3 common sleep tracking technologies that we came across. Next slide, please.
Right, this is an example of a sleep tracker, low cost or zero cost. Zero cost because it's the basic features of it are free. This is the app that I've used for the past few years. The way it works, I think Sawani just mentioned that an ideal moment of waking up, first of all, if you can wake up without an alarm and just naturally, that seems to be the best. It's associated with the best quality of sleep. But for people who have to use alarms, waking up in the lighter stages of your sleep is the best. Now, I'm not sure if you mentioned, but each sleep cycle is approximately 90 minutes. And in the lighter stages, some people, not everybody, you tend to move more or make some sound. And so some of these apps that exist, they listen for these sounds, and they're actually quite sensitive. I've tried a few, so I've kind of put it on in a silent area and made very, very small noises, let's say 2 meters away from the phone. The microphone is on the phone itself, and I still see there's a graph of sound that shows you how much is picking up your movement. But it's not super precise, but it's fairly effective in showing you how much you're moving, what your sleep cycles are. You can see on the right, there's a stage of awake, sleep, deep sleep, and also time. But the neat thing about it is on the left, you can see you can set an alarm for a 30-minute. You can change the 30-minute time frame, but for a 30-minute time frame, and it just listens to your body, to the noise you make, and it wakes you up when you have the lightest sleep. And so this is an alternative to people who have to use an alarm. Instead of have it go off exactly at 7 a.m. sharp, it goes between 6:30 to 7, so you feel wake up a little bit more less groggy, essentially. And I have some examples of it here as well for myself. So we can see on the bottom left of the slide, that's a bad example. That's when I felt tired. 4 hours, 52 minutes is amazing for some people. For me, it's not enough at all. But you can see that if you look at the cycle, it shows you how much I've been awake. So the more times you're awake, that's associated with less sleep quality. It also shows how long did it take you to go to sleep. That's quite good information for me. Obviously, you can probably just remember the night before how long it took you, but if you want to know it in terms of statistics, there you go. You can use these apps. Again, I wouldn't probably focus too much on the percentage, but it gives you a little bit of information. And this is Dr. Curnew's information. This is your Fitbit. I'll probably leave this to Dr. Curnew. He's a professional in Fitbit, but you can see it as some of the months on averages, February, March. This is all this year. And what the averages are, I'll put your best here, Dr. Curnew, Friday, September 6th. The day before your birthday. That's probably why you had the best night of sleep, 8 hours, 28 minutes. So what do you think about the Fitbit sleep tracker, Dr. Curnew?
Well, it's interesting. It gives you a approximation, and I find that useful. So you can see on the far right, I had 4 days in a row where I actually had 8 hours of sleep. So that was on holidays in Greece, and that was I can't remember the last time I had that, and I just look at the average for this year. It says 5.5 hours. Now, it says I'm awake an hour plus most nights. So And it's interesting. If I look at my wife's pattern, she has trouble falling asleep, where I just bang, fall asleep, but I don't stay asleep. So her best sleep is actually early in the morning. So when I get up to go to work or go to the gym, is I have to be very quiet so I don't disturb her. She can come in the bedroom at nighttime, and I won't hear her at all. So it's so any thoughts on people who fall asleep quickly versus those what do get people get their best sleep? I get my best sleep at early on, and my wife gets her best sleep towards just before she wakes up. Any thoughts on the team on what that actually means?
It's an interesting question, actually. I don't have a lot of details on it, but I was listening to a few podcasts and listening to this expert talk about sleep chronotypes. And essentially, what he was saying is that for some people, it's partly genetically determined. And I think the line, I don't want to quote him, but he said you can't change it much. And so essentially, you have to go with it. I think it seems like it's a controversial statement for some people. Some people think that you can sleep whenever, and it seems to be okay. Some people think you have to sleep during nighttime. Some people think that night owls, they can be as healthy as early risers. It seems like it's up to debate, but there's some genetic evidence that sleep chronotypes and your type is a little bit out of your control for some people. We also know that as you age, you start to wake up earlier, and especially teenagers are more night owls. Some people remain night owls for their entire lives.
It's kind of interesting sleep patterns. So you definitely have less quality sleep and more awakenings as you get older. You also need less sleep as you get older too as well. I like this concept of, as Dr. Gottschalk and the team was talking about, is that during sleep, it's like a car wash to your brain, is that, you have to actually clear these amyloid deposits. Amyloid can actually lead to dementia. And you showed association with diabetes and different patterns or not enough sleep in general. So what I've done the last while is that really I try to spend more time in bed, and we'll talk about, going to bed every same time every night. And my best quality sleep is early on. So to me, the key to my success is going to bed earlier and letting myself fall asleep earlier. And what I try to do on the weekends, if I can, is not always set an alarm. During the weekdays, I unfortunately have to set an alarm. Um, and I think it's sort of fascinating, and I'm actually spending a lot more time with my quality of sleep. So what I tend to do is I listen to a podcast, and I'm not even actually looking at the screen so much. I'm listening to what's going on, and I usually fall asleep. And it's not like high intensity uh, podcast. I enjoy that type of phenomenon. Is that the right thing to do or not? I need to work on, I'm a nighttime eater, but one of the patterns that I've changed over the last months or so is I'm actually restricting my time eating. So I tend to be a night eater. Ideally, I'd love to eat from, about 8 in the morning to 4 in the afternoon and call it quits. But no matter what I do, I'm a nighttime eater. So what I've done is I eat more in the evening time. I wish I would stop eating. I should basically, if I was smart, go for a walk after I finish supper and wait those 2 to 3 hours or whatever. But I'm not very good at that. I find that food helps me fall asleep. I'm not sure if that's true or not, psychological. Um, but I find I'm more energized if I don't eat for a good part of the day. I don't get those dips, maybe sugar changes. I don't know changes. But I do drink a fair bit of coffee. Um, I'm not sure I need the coffee, and I feel best if I exercise. My best is like tomorrow morning. I'm going to be at the squash club between hopefully at 5:30, between 5:30 and 6 o'clock. Try to get there for 5:45, and I'm going to spend a 45-minute workout before coming to the office. And I'm going to actually, I'll pick up a coffee along the way and a couple coffees here and there. And I find for that morning time for next 4 to 5, 6 hours, I'm at my best. So I'm a morning person. And as you're right, young students, as we're young, and we tend to be more night owls. So remember, you can do your best productivity at nighttime. My daughter's up all night long. I'm fast asleep and I'm up first thing in the morning. And I've been that way a good part of my life. And I try to do my best work in the morning time. So, and my best sleep is first when I first go to sleep. So I try to capitalize on that and to look at that. So now if you look at the patterns there, um, I do wake up a lot. I notice that I get my deep sleep early on often, and REM sleep tends to happen more towards the morning time, and that's sort of a characteristic of some things there. So, but I need to spend more time in bed.
Alrighty, no, that sounds wonderful. I know it's a complex thing, but it seems like I think you've worked on it. In the pandemic, it seems to have been worse. But the other question we have is, what are some disadvantages of sleep trackers? And we're gonna have Dr. Raymond tell you a little bit about this. We have the expert on the podium.
Sleep stages. So I was just wondering, Dr. Gottschalk, do you have any experiences with the Fitbit and how it may help patients in identifying how they are sleeping?
Yes, that's a very pertinent question given the burgeoning use of wearables. And in fact, everyone really could use something like this. The problem with looking at them, there are new iterations coming out every couple of years. And so the validity of some of these things is not proven. There's much more hype than there is accuracy. And for some people, what it does is it then facilitates that absolute angst that they are not performing. So they get performance anxiety with regards to trying to get the best Fitbit outcome. So I would be cautious with these wearables at this time. They can be illustrative in some ways. They're not particularly accurate, but they are getting better. So at this point, if you're interested, that's fine. If you've got a worrying bent through your soul and spirit, not a great idea. So back to you.
So so if you are interested and if you want to use it as a learning purpose, how's the best way to approach? What's the parts that you find helpful in this on these applications?
Well, it can be used really as a device to identify when you are falling asleep or when you are in bed. Because often what we get with insomnia, we have a device called an actigraph, which really tracks movement. It can be fooled by those who lie in bed like a corpse and don't move at all. But typically people, when they're not sleeping, they're moving around, and the actigraph will pick up movement. And then when you're asleep, these movements go down. So it gives you a pattern. And this pattern shows you their sleep staging and their cycling. Where the actigraphs are helpful is in people with insomnia. There are many people, when we bring them into the sleep lab and we do a sleep study on them, and they sleep seven hours complete, yet they say, oh, I didn't sleep a wink last night. And you try and show them the data, and they barely believe you. They say, well, I didn't sleep at all. I heard everything. And so there's a misperception for some people. And many people with insomnia, they overestimate how much time they are awake. And they underestimate their sleep, because this has become a self-fulfilling behavior. And so that's why we are not that keen on people tracking the sleep too much, other than if there's a rhythm disturbance. And there's some very strange rhythm disturbances where people can't entrain themselves on a 24-hour cycle. That's where these can be very helpful for us. But beyond that, at this point, I'm just not aware of the latest wearable data as to accuracy compared to sleep studies. They're coming out all the time with improvements, but at this point, it's not Madison Avenue yet.
There we go. You heard it from the experts. You got to be cautious with some of these sleep trackers. Alrighty.
So here's another study that we found that talked about the effectiveness of sleep tracking technology. So in this study, they took 7 on-market products, 4 of which being watches and 3 of which being the mattresses we were talking about. So some pros that they found was these devices were capable of awake detection. So they do detect when a person is sleeping or when they're awake. And also has high performance in sleep detection. So it detects it quite accurately in terms of their sleep quality, as well as the duration of the sleep. However, some cons that they detected they found during this research study was it has a mixed result of sleep stages. So it's not super accurate. It doesn't detect, it doesn't correctly identify the different stages as to the stage 1, 2 sleep, 3 and 4 sleep, or the REM sleep correctly. It just gives the patients an idea as of how long they've been sleeping and if there's any range of motion that has happened during the middle of the night. So it is effective overall, but there still can be some improvements in terms of the high accuracy of these technology. So what are some ways that we could assess sleep quality without using these technological trackers? So of course, there are many different ways, but one way that we found to be quite effective is asking yourself these following questions. And it's a full list of 19 questions if you're interested, but here's a condensed version of it that summarizes the important points. First one being, how long does it take to fall asleep? And regularly, this should be under 30 minutes. If you're flipping over on bed for over 2 hours, that's probably problematic. The second question is, how long are you asleep in bed? You should be asleep for more than 85% of your total time. If you're lying on your bed, playing on your phone, that's probably not the best thing to do. Third question is, how often do you wake up during the middle of the night, and for how long? Ideally, you wouldn't wake up in the middle of the night, but if you do, it should take you less than 20 minutes to fall asleep again. Fourth question is, do you have difficulty getting up in the morning? And as we previously talked about, this could be an identifier as to how good the quality of your sleep was or how effective your sleep was. The last question is, do you have difficulties concentrating throughout the day? So if you were lacking a ton of sleep, you probably would have a lot of difficulty. So these are some questions that you could ask yourself without using those technological trackers. The other thing that you could use, which is kind of quite beneficial, is the use of a sleep diary. So a sleep diary comes in 2 pages, one to be completed in the morning, one to be completed in the afternoon. For the one that's completed in the morning, it mostly asks questions about how is your sleep during the night, such as how long did it take for you to fall asleep? What time did you fall asleep at? Or what time did you wake up in the morning? If you're interested in the sleep diary, I believe Rab would put it up in the comments, so you could download this PDF for you to write your own diary. The second part to the sleep diary asked about what you did before the sleep, so you should complete this in the evening before your sleep. And it asks us about what did you do during the day, such as were you drinking coffee? Did you exercise? And what were you eating? So these are topics that we have covered or we're going to talk about, and we're going to explain why these are things that you should really look at. All right, next slide, please. And one interesting thing that we found while we were doing our research is the connection between sunlight and sleep. Plants do photosynthesis, unfortunately humans don't, but don't think sunlight is not important to us. Sunlight matters quite a lot. Sunlight can actually affect the way that we sleep. So this study has found that direct exposure to sunlight in the morning can actually allow you to sleep more at night and take fewer naps during the day. So having that prolonged duration of sleep. Essentially what they did in this particular study is they took a group of healthy old adults age 60 and above, and they kind of just exposed them to sunlight, to expose them to different various amounts of sunlight to see what happened during their sleep. And of course, the study finding was that elderlies exposed to high illuminescence levels in the summertime correlated with better sleep efficiency. So they were sleeping deeper, they're less tired during the day, and they're also taking less naps, which is an indicative sign of how effective their sleep was during the middle of the night. Next slide, please.
So another interesting topic that we wanted to look at was waking up with or without an alarm and which one's better. I'm sure like many of us here, I'm also someone who I'm really dependent on my alarm to get up in the morning, especially on my phone. So this is just like a quote by a sleep physician, and she just said that your alarm can wake you up during the middle of a sleep phase, which can cause sleep inertia or the groggy feeling from abruptly interrupted sleep. And if you can see this bar graph at the bottom of the screen, it was from a study where these individuals asked their employers of a company how well rested they felt throughout the day, and they also wanted to know how they woke up during the day. So we can see here that a large percent of these employers, so about 61% of these individuals, were the ones who woke up naturally, so without an alarm, and they were the most amount of the employers who felt more well rested throughout the day. And then we can kind of see how this number decreases when we go down from using different type of tracking devices through a digital alarm clock to an alarm placed away from our bed, and finally to our phone, which only 48% of the employers felt well rested. So waking up naturally without the use of an alarm, from this we can see has a significant benefits of sleep quality and overall well-being. By establishing these and maintaining regular sleep schedules, it can help individuals regulate their circadian rhythm, as well as improving feelings of restlessness as well. So I think a big thing we can get from this is just how by waking up naturally, it can not only help increase an individual's mood, but also increase their productivity throughout the day, as we can see how well rested these employers felt by waking up naturally too. Next slide, please.
Yeah, so now we'll shift gears and look into some non-medicative aids for helping you sleep. So starting off with food and just eating before bed in general, we have a widespread belief that eating before bed is usually a bad idea because it could lead to weight gain, certain diseases, or sleep disturbances. However, there is significant new evidence showing that it's a bit more complex than that. And the real answer depends on the portion, the type of food you're eating, the timing, as well as pre-existing conditions that you do have. Right, next, please. Yeah, so in terms of the benefits of eating before bed, these are usually applied when you have a light snack. And this light snack is one that's high in protein, fiber, and low in carbohydrates. And one of the benefits could be for people who are specifically diabetic and taking insulin or other diabetic medications, where they run the risk of experiencing low blood sugar, also known as hypoglycemia, and a snack that's high in protein and healthy fat could actually help prevent blood sugar spikes or severe drops throughout the night, as well as to the general population. It can also help you fall asleep faster when you have foods that are rich in tryptophan, which is an amino acid that's used to make serotonin and melatonin, other hormones that help you sleep, and decrease sleep latency, which is essentially the time it takes you to fall asleep. And some examples of these are dried fruits like almonds and walnuts, or even having a warm glass of milk, and even having kiwis has shown to improve sleep latency. Next slide. And then in terms of the risks, these risks usually run when you're having a large meal close to bedtime. So one of the most common ones is experiencing gastroesophageal reflux disease. And this essentially occurs when the contents of the stomach start to press up against the esophagus when you lie down for bed. And this could lead to symptoms such as acid reflux, nausea, or heartburn. And it is actually shown in this randomized case control study with Fujiwara that showed that people who had dinner to bedtime within 3 hours had 7 times more likely symptoms of GERD compared to people who had dinner that was 4 hours before bedtime or greater.
Yeah, go back 2 slides there. You mentioned that, or just go back to blood sugar spikes. Tell me about blood sugar spikes and what happens when you eat. Some people feel groggy after they eat, and I mean it could be a tryptophan effect, but I don't think it's necessarily that as well. Just carbohydrate. What do people feel sleepy afterwards, and how does that affect your blood sugar? Can you expand a little bit about that at all?
Yeah, so people usually feel groggy when they have a large meal, and like you mentioned, it could be the tryptophan in the food, such as turkey, for example. After a Thanksgiving dinner, people usually feel very tired. And it also is due to the fact that a lot of blood flow is being directed to your digestive system, which usually leaves you with feeling less energy and less energized in general. And then in terms of blood sugar spikes, when you have I had to specify that this light snack had to be low in carbohydrates because one that's high in carbohydrates could spike your blood sugar before bedtime, and that could also lead to feelings of actually more energy compared to when you have high protein or high healthy fats or fibers that kind of sustain your blood sugar for a long time and have a slower release on how your blood sugar acts when you're sleeping.
Thank you.
Right. And in terms of sleep, eating's effects on sleep variables, another study had shown that nocturnal eating or eating at nighttime could actually have detrimental effects on various sleep variables, such as sleep latency, which we mentioned previously was the time it takes to fall asleep, as well as decreasing your sleep efficiency. So this study in specific, the graph on the left here, shows that you have nocturnal caloric intake on the y-axis. So the more calories you're eating at night, you'll actually take longer to fall asleep, as shown by the increasing trend in sleep latency. And then on the graph on the right here, as you decrease your caloric intake and you actually show an increase in sleep efficiency shown by that downward trend there. Eating at night can also be shown to affect how you burn fat or oxidize your lipids. And this was shown in a study where there were two groups and they were each given 3 meals. The first group was given breakfast, and the second group was given that same equivalent meal, but right before bed. And it is shown that eating breakfast and avoiding that late night meal actually sustains lipid oxidation. So it helps you with breaking down more fats and more lipids as you sleep, as opposed to having a large meal before bed that actually decreases lipid oxidation relative to having breakfast or skipping that meal right before bed. And that's shown in the graphs outlined in red here. The hour by hour oxidation shown on the left-hand side, or labeled as B. The blue line is showing when you have breakfast and you skip that late night meal, you have an increased lipid oxidation as opposed to having a meal right before bed, shown in the red line, is showing decreased lipid oxidation. And then the same trend follows on the graph right next to it in cumulative lipid oxidation, showing that having breakfast and skipping a meal before bed has improved fat oxidation and it helps you burn fat as opposed to eating right before bed. And then let's switch gears to alcohol. Now, a common belief is that alcohol actually helps you sleep because it does act as a sedative and interacts with neurotransmitters that are important for sleep. And large amounts before bed can actually decrease sleep onset latency, which essentially means when you drink alcohol, you can actually fall asleep faster. And many people think that it helps them sleep. But the cost of falling asleep faster is you have a much poorer quality of sleep, and it's accompanied by chronic sleep disturbances, as well as decreased time spent in that slow wave deep sleep, as well as REM sleep. So the general idea or consensus across clinicians is that although it can help you fall asleep faster, it interferes with staying asleep. So they recommend try to avoid alcohol at least 3 hours before bed. So putting this all together, the definitive answer or the recommended answer is to eat 2 to 4 hours before sleeping. And the reasons for this were it helps avoid symptoms of GERD, prevents sleep disturbances, it avoids symptoms of sleep latency as well as nocturnal awakenings. And it also allows you to have adequate time to digest your food and transfer those stomach contents from the stomach to the small intestine to avoid those GERD symptoms. All right, now moving on to exercise. Now, one of the many benefits of exercise is that it can help you fall asleep faster and improve your sleep quality. And this is shown when moderate aerobic exercises actually increases the amount of slow wave or deep sleep you get. And it also improves the efficiency as well as the total time of you spend sleeping when you perform it greater than an hour before bed. However, you do run a risk when you exercise within an hour before sleeping, as when you exercise, you release endorphins that increase brain activity, which can help you keep yourself stay awake. And another thing is it elevates your core body temperatures, which signal your body clock or your circadian rhythm to start staying awake. So the rule of thumb for exercising is to at least exercise 2 hours before bed to allow those endorphins to wash out and for your core body temperature to drop. Now, moving on to bedtime routines and the importance of location. So, bedtime routines are essentially the activities you do the hour before you go to bed. And it's shown that regularities and being consistent in your bedtime routine actually show you have better sleep patterns, and that leads to better overall health outcomes. In a specific study we highlighted here showed that adhering to a structured sleep schedule every night has actually improved more regular sleep timing, as well as improving the alignment between sleep and circadian rhythm when people had a poor alignment before. So we talked about shift workers when you have night shifts or running on different times of sleep. When you maintain a consistent routine, you can actually correct that alignment and improve your sleep quality moving forward. And some ways you can kind of test this yourself is to take a look at the five senses when you're about to sleep. So for vision, for example, we know that light regulates sleep rhythms. So insufficient darkness could actually reduce your sleep quality. Thinking about what you can feel, the comfort of your bed and your bedding, anything you can hear, we know that noise should be minimized, as well as things you smell, such as clean air or pleasant smells. These are all things we can test every time we're about to go to sleep to make sure that we keep it consistent as well as have regularities in our sleep patterns. Right, now moving on to the effects of sleepwear. So does it really matter what you wear when you sleep? It's actually shown in across these two studies we highlighted here that the different materials of sleepwear have actually varying thermal and moisture handling properties. And what's shown across both studies was that wool sleepwear is actually superior to things like cotton or polyester, because it's shown to decrease that sleep latency, as shown in 12.4 minutes for wool, where it's almost doubled when you're wearing polyester or cotton. And it also increases the time you spend sleeping, as well as the efficiency, and even the time you're spending in deep wave sleep when you're wearing wool compared to cotton and polyester. And this is shown even at lower ambient temperatures of 17 degrees or higher temperatures going up to 30 degrees. Now moving on to this TED Talk here that talks about the importance of sleeping positions. So one thing I liked about this is how it always talks about, we talk about the importance of posture, and even right now I'm trying to force myself to sit upright, but we also forget that the importance of sleeping posture can have a drastic effect on our day-to-day lives, because having good sleep posture can prevent you from feeling that tightness in your neck and shoulders. It can help you improve your digestion as well as circulation, can help treat sleep apnea and reduce snoring. And all in all, these are going to help you boost your energy levels and your core strength as well. And moving on to some specific sleeping positions. Now, in the TED Talk, he talked about two specific sleeping positions that he recommended, one being the soldier, when you lie on your back, and the other being the dreamer, when you can sleep on your side and fit a pillow between your legs so that your knees aren't sitting on each other. And this can help alleviate hip pain, any strain in your spine, as well as treat symptoms of snoring, as well as tightness in muscles when you wake up. Right now, touching on the best pillow. Well, you know that if your pillow is too high, it can cause these uneven curvatures in your spine. And the same thing as when a pillow is too low. And here we have a picture of a pillow, I believe Rad enthusiastically endorses, if you want to touch on that.
Yeah, this is my favorite pillow. I don't think I'm gonna change. So essentially, the reason I like this is an IKEA pillow. I was trying to find its specific name. It was just labeled as an ergonomic pillow. If you look at the groove in the middle, it's made specific so that it's stiff enough to support your neck, the curvature of your spine in the neck area, but it's soft enough that it's comfortable. Because there's some pillows, even though they seem quite comfortable in terms of its, the stiffness is quite soft and you want to sleep with it, but it doesn't have great neck support, and you can see that in some of these pictures where ideally you want it to be one, the subjective feeling of comfort. You don't want any strain, but also you want the neck to be as parallel with the bed as much as possible. And so on the top left, that is not great. It's too high. The one on the right is too low. And again, I endorse that. If you want to go to IKEA, grab one of those. Some people don't like it. I personally love it. So there's my personal endorsement.
Okay, so another topic that we kind of wanted to talk about regarding sleep was the relationship between music and sleep. So we found this specific study, and in this study, they brought together 52 women who were over the age of 70 who did experience symptoms of insomnia. And what they did was they wanted these participants to play. So they were able to choose their own album of music of their own choice, and they were incorporating music into their nighttime routine. So they were going to listen to music before they went to bed for 10 consecutive nights. And by doing so, the participants, prior to listening to music before they fell asleep, it took them about 27 to almost like 69 minutes for these women to fall asleep. However, after incorporating music, it reduced this amount of time to only 6 to 13 minutes. So not this study shows how music is able to it reduced the onset time for these women to fall asleep, as well as it reduced the amount of nighttime awakenings and enhanced their sleep satisfaction. But one big thing is, why does music affect sleep? So why is music causing these women to fall asleep sooner, as well as have a better sleep? So one idea is that it's believed that so as we know, a big thing that can cause individuals to have poor sleep is stress, and stress is related to having high levels of cortisol. So sleep music, by listening to music, it's known that music can actually decrease these levels of cortisol, and our brain is able to interpret these sounds and cause a physical effect throughout our body. So by listening to music, it's going to decrease these levels of cortisol, so these individuals can possibly feel less stressed and have better sleep. Next slide.
All right. This is just an example of some of the music. I think, Sharina, you told me that in that study, the music of choice was subjective. So anybody just chose what kind of music.
Right, yes, they just chose whatever
Yeah,
album.
and also, I think since the pandemic, I don't think I have gone many nights without some kind of noise helping me sleep. Again, that's just me, my anecdotal experience. But it's either a podcast I listen to, some of the Dr. Curnew, and that's how I usually sleep. If I'm too interested in the podcast, then it's probably not a good idea. But sometimes I've tried different kinds of music. Some kind of music, without lyrics, is the best. But the best thing I have found are things like, not white noise, because if you listen to white noise anybody's tried, it's quite annoying. But something like brown, I'm just going to play 2 seconds of this so you can see how soothing it sounds like. And it kind of just it's a bit of a suppressor on the mind, especially if you have an active mind like myself. I have the most creative thoughts right before bed, and so I have to kind of shut it off with something like this. I'm just gonna show how it sounds like. It's a little bit like the airplane sound. I'm not sure if people like the airplane. I quite like it. I've tried airplane sounds, this one. In fact, if you look at the comment section of such videos, it's enormously popular, especially with people with insomnia. It helps a lot of people. So if you haven't tried this, give it a try. It's wonderful.
Right. So now we are going to go and talk about medicated sleeping aids. So these can vary from supplements to prescription medications. So this is a list of various different types of prescription drugs that individuals can use for different types of sleeping disorders. I'm not going to go through every single drug that you can see on this slide, but the main thing we wanted to point out was that there are different prescription drugs that individuals can use for different symptoms that they are feeling for their sleeping disorders. Again, there are drugs that can help them with falling asleep, staying asleep, and as Siwan mentioned, insomnia is not just one or the other. It could be a bit of both for some individuals, for having trouble of falling asleep as well as staying asleep. So there are prescription drugs that individuals can take that can help with both. The main thing we did want to say is, of course, this is something that you must contact and discuss with your doctor regarding what sort of medications you should take as well.
So just a note about sleeping pills in general. To me, they're a double-edged sword. They're best to help you fall asleep earlier, maybe not keeping you asleep. But the other unfortunate part is it makes you more prone to falls, daytime somnolence the next day, and maybe accelerates dementia as well. So there's pluses and minuses, and some people are really dependent on them. This is something I would try to not use, but certainly if you're really stuck, speak to somebody who knows a lot about these different medications. I'm certainly not an expert. I'm kind of afraid of them myself in general.
Yes, so as we did just talk about sleeping pills, there are, again, like Dr. Curnew mentioned, side effects and safety measures that we should be aware of. There are various types of side effects. This can range from constipation to dry mouth, headaches, muscle weakness, as well as digestive problems, including gas, heartburn, and nausea. Another big safety concern regarding sleeping pills is that when an individual regularly takes these pills, they can lead to great independence on these pills. And if they do stop taking these pills suddenly, it could cause their insomnia to become worse. And this is known as rebound insomnia. Not only can their insomnia return, but again, as I mentioned, it could become worse. And it kind of defeats the purpose of them taking these sleeping pills in the first place. So now that we've covered a few different types of prescription drugs and sleeping aids that individuals can take, we wanted to touch on melatonin, which is a type of supplement. Before I talk more about the supplement, I just want to state that melatonin is a hormone that is produced by our pineal gland in our brain, and it helps to regulate circadian rhythm, dreaming, as well as our sleep. Its production and release in the brain are influenced by the time of day. So it does rise in the evening when it gets darker, which kind of does relate to us being more tired in the evening. And it does drop in the morning when there is light, again, which is why we're more awake and alert during the day. Melatonin production does also decrease with age. However, as I mentioned, there are supplements that individuals can take to help not only to help with this as well as different type of sleep disorders. So it is a common treatment for several different types of sleep disorders, such as insomnia, jet lag, as well as delayed sleep phase disorder. And there have been several studies done, specifically this one trial that we wanted to talk about, that shows that melatonin is effective in treating insomnia. So in this specific study, what they did was they just had different groups of patients, and they gave these patients the melatonin supplement as well as a placebo. And they were able to see that the patients who did take the melatonin supplement experienced significant improvements in their sleep quality, as they were able to sleep faster as well as stay awake for a long period of time, stay asleep, sorry, for a longer period of time. Again, as there were side effects and safety measures that individuals had to be aware of for prescription medications, there are side effects regarding melatonin as well, and this can range from headaches, dizziness, hypothermia, lucid dreams, as well as daytime sleepiness. So that is a big reason why individuals should not drive within 5 hours of taking this supplement.
So to me, that's a controversial. If you go back one more slide there, I think the best place for melatonin is for in shift workers. Melatonin tends to rise just before you go to sleep. So if you're jet lag, changing time zones, if you so you're going to go to bed and you're changing going to Europe, you might take melatonin before you get on that Air Canada plane, because there's no pilot strike at this point in time. Or if you're a shift worker before you're going to sleep. Outside of that, it's not clear that melatonin provides a lot of meaningful results. Dr. Gottschalk, our sleep expert, wasn't a great fan of that, but certainly something to talk about. And because most of these things are non-regulated, the quality of melatonin may be poor too as well. And so, again, something to talk about with your doctors. I would only consider that for people, shift workers and people changing time zones would be the best use of that. Other than that, talk to other physicians and healthcare providers who know a lot about that. So I'm not a big fan.
So now we just want to touch upon like the different types of melatonin that you are able to purchase, fast versus slow dissolving. So fast dissolving medication is medication that quickly dissolves in the stomach. So these are medication that takes about effect within 15 to 30 minutes, so very rapidly. You do not need to chew or need water for these type of medications. And the purpose for these type of medications is it is proposed to allow for the rapid onset of sleep. It's research does says that it can help individuals who have difficulty falling asleep initially. Again, it kind of helps with that fast dissolving mechanisms. And slow dissolving medication, again, it's kind of in the name, it has an extended release. So these type of medication allow patients to stay asleep for a longer period of time without waking up in the middle of the night. So these type of medications, again, are designed to release a lot slower and help maintain sleep overnight. So we did touch upon the supplement of melatonin. There are other supplements as well. However, the research about this is still ongoing. Researchers are still looking on if these supplements truly do help for sleep, but these are some supplements that we wanted to touch upon. So the first one is magnesium. Magnesium is a mineral that does play an important role in many of our body processes. It is believed that magnesium can influence both our sleep quality as well as its quantity. Many people do get magnesium from our diets, from our everyday diets. However, some people do wish to increase the amount of magnesium levels that they intake by taking dietary supplements. Another supplement that we want to talk about was ashwagandha. This is a type of supplement that Again, there are studies upon this that are still ongoing on if it is truly as effective as believed, but it is believed to reduce sleep onset latency as well as increase sleep efficiency and extend your total sleep duration. The third supplement we want to talk about was GABA. This is an amino acid that does reduce the activity of our brain cells. So this supplement is known to decrease how long it does take an individual to fall asleep. So again, that it reduces the sleep onset latency. And the last one that we wanted to touch on was l-theanine, which is a type of amino acid, and it's naturally believed to be occurs in the leaves of tea plants. And this supplement is believed to, again, enhance sleep quality by reducing the amount of times an individual wakes up during the night. The final type of therapy that we wanted to touch upon was cognitive behavioral therapy for insomnia, also known as CBTI. As I did previously go through supplements and prescribed drugs, there were a lot of safety concerns. And as Dr. Curnew mentioned, it's not something that he is a fan of for patients taking as well to help with their sleeping disorders. But cognitive behavioral therapy for insomnia, or CBTI, is a type of therapy that helps individuals with their thoughts and behaviors that are causing them to have issues with their sleep. And it's basically allowing them to replace these thoughts with with habits that can support their sleep. And in a certain podcast where we actually got this study from, the physician in this podcast was actually saying how CBTI is considered is actually as completely safe, and he sees it as more effective in the long term than these sleeping pills. And he was saying that he was actually comparing it to what I mentioned before. So for individuals who are part of CBTI, cognitive behavioral therapy, they'll go see a therapist to help them with the issues they are having for falling asleep. And when they stop seeing the therapist, they're still able to maintain good sleep because they have practiced and learned these good habits. However, as I mentioned earlier, people who take sleeping aids, prescription medication, once they stop taking those prescription medication, they can have a rebound insomnia, which again, as I mentioned, going back to the same bad sleeping habits, as well as having worse insomnia symptoms as well. So that was another reasons why a lot of physicians are trying to push for individuals and other doctors for the initial treatment of insomnia to be cognitive behavioral therapy.
All right, thank you so much, Rena. I know CBT has some different uses. Any more questions? We have other webinars on sleep. You can go to Dr. Curnew on YouTube, put sleep in the search bar, or just put Curnew and sleep in the search bar of YouTube. You see some of the videos and webinars we have. The one with our expert, Dr. Raymond Gottschalk. We have Sleeping Better. You can take a look at that. We also have sleep apnea and hypertension, an in-depth look onto that. We also have a brief video on how to sleep fall faster. It's actually quite a neat video. Talks about a meditation technique to minimize stress. Last thoughts, Dr. Curnew.
I think you really get a lot of good information. So if you look at Dr. Gottschalk's one is really quite good. If you have high blood pressure during nighttime, especially as sleep apnea, so basically if you have sleep apnea, you probably have blood pressure, hypertension at nighttime. Blood pressure should go down at nighttime. So it's something we can look at. I forget, are we going to talk about some good tips on how to have better quality sleep, how to fall asleep to this one, or should I tell that one now?
No, go ahead.
Okay, so you can all chime in on this. So basically, your bedroom should be a dark place, should be a place to sleep. You should enter your bed for sleep. You should be in a cool environment. And what type of clothes should we wear before going to sleep again?
It showed wool is better than cotton or polyester.
Okay. Ideally is that not to eat 2 to 4 hours before going to bed, not have too much to drink. Us guys will have the prostate problem. Women may have an overactive bladder, um, maybe causing an issue, and not to drink coffee somewhere between 4 to 7 hours beforehand, depending how sensitive you are to coffee. You should be in a relaxed mode. If you're not relaxed, you can look at on the video how to fall asleep faster. And if you want to have a little bit of food that brings up tryptophan, we always remember having a glass of warm milk. Tryptophan turns into serotonin that can help you sleep better. What nuts again are you supposed to have before going to bed?
Almonds and walnuts can help.
Okay, a couple of them may just have a slight sack there. Um, I would say about exercise. Exercise when you can. If you're going to not exercise so you can get better sleep, I think you better exercise. So, is that obviously you have to wind down after exercise. Some people, I find if I've exercised a lot that day, especially earlier in the day, I feel more tired and I sleep better. But there are times when I can just exercise before going to bed, and I'll just slowly withdraw. And I try to calm my brain down over time. I find different webinars, different things. You got to use music if you want to, or some brown noise, whatever helps you work. And if you can't fall asleep after 30 minutes, get up, get out of bed, walk around, do something, read a book, and then try back to sleep later. Unfortunately, as I get older, my sleep gets more fragmented, and know your pattern. My pattern is I get my deepest and best sleep first thing at nighttime. So I usually one of those people who hit the pillow and I will fall asleep, but I won't stay asleep. And traditionally, what I like to do is when I get up at nighttime after going to the bathroom is have a little snack. I'm trying to avoid all that at this point in time. And I just had, during this webinar, I just had my dinner. I'm going to go home. Will I eat any more before going to bed the next hour to 2, 3 hours from now? I'm not sure. I'm going to try not to. And any other pearls in there for anybody?
You summarized it well, Dr. Curnew. Just wanted to wish everybody the best sleep tonight. Have a glass of warm milk and sweet dreams.
And watch one of our webinars. I can put you to sleep any night with our team over here. So I want to thank the team for a wonderful presentation. And thank you so much. And have a good night's sleep, everybody. Good night, everybody.